Hi guys, and welcome back to the channel. In today's video I'm going to talk about a topic that I don't think gets a whole lot of airtime across YouTube and any other platform where people are talking about running injuries, whether you're hurt or whether you're actually injured. When we think about exercise, we need to remember that exercise is a stressor. So anytime we do any sort of exercise, and then for the sake of this video we'll just talk about running, it's putting a stress on our body. And once that's managed and you manage the load and the intensity, the volume that you do, you can start to build your body, wait for adaptations to happen during your training process, and therefore get fitter, faster, stronger. And that's the process behind what we're all trying to do. And therefore allowing our body to go, when I say don't do too much, if we don't do too much, we need to allow our body to go through the adaptations that we need in order for us to get fitter, faster, stronger. And there's a couple of physiological things that happen, and some of those physiological things happen quite quickly. Some of the other physiological things take a little bit more time, and that's why we need to manage our progress. When we do any sort of training program, there'll always be like what we call the progressive overload. So each week we'll overload, then we'll have like a back off week after a couple of weeks, and then you start the process again of overloading and backing off. And that's kind of the principles of all training, whether it's run training, cycle training, whether you're doing any sort of Olympic lifts in the gym or anything. Most people are using the progressive overload. Most people are trying to stress their body to the most that they can fit into their lifestyle, back off a bit, let the adaptations change, and then we go again. But what we don't ever talk about, or we don't talk about enough, I think, is that the difference between overdoing it, so kind of doing too much training, and in contrast with not allowing your body to recover enough. And there is kind of a difference in that. So in essence, what I'm trying to say is if you do too much too soon with not enough rest, something's going to happen in your body that's going to stop you in your tracks. And that might be after 1 week, it might be after 3 weeks, it might be after 5 weeks, it might be after, who knows. But eventually, if you're doing too much too soon and your body's not having that ability to adapt and recover, then you're going to run into a problem. And the problem is going to be that you're going to get chronic accumulation of low-grade inflammation in your body. This sets us up to have a network of a pro-inflammatory environment for our muscle and our nervous tissues. And this is not good. When this happens, things start to hurt when we load them. Okay? So think about that. When we add load to a tissue that's in a pro-inflammatory environment, and when I say tissues, I'm really talking about muscle and nervous tissues, they start to hurt. Things start to get painful. Things start to niggle. And the question is, are you injured or are you just in pain? And that's kind of the philosophical question that I think we don't often talk about too much, is the difference between being injured and being in pain. When we don't manage the amount of stress, and when I say stress, I'm talking about physical stress, so the volume and the intensity at which we run at. When we don't manage that, we get a neuro-immune response in our body. And that neuro-immune response can cause pain. So when we think about it from a structure function type of a standpoint, we don't actually have any tissue damage in our body, because that's not what's causing the pain. Remember, I spoke in previous videos, pain has a myriad of causes. It's never just one cause. So when we just reduce things to a one tissue damaged, you're always going to run into problems in terms of getting yourself rehabbed or back to training. So when we have one of these neuroimmune responses to pain, it's basically a point where our whole body is under just too much stress and something's going to hurt. In clinic, classically, I see these coming in. When I see people coming in with this sort of thing, they're usually the plantar fasciitis people, the anterior or medial knee pain, the piriformis syndrome, the sciatica, the chronic low back that just doesn't go away, shin splints. They're kind of runner's knee, the other one, the iliotibial band. So when I hear those people coming in and it's like, I've been to X, Y, and Z, I've been to this physio, I've been to a chiro, I've been to my GP, I've been around the world and back, and then they wind up on my table because somebody told them that I've treated them for running injuries before. Probably my biggest battle, and the first thing I've tried to do is just explain to them or get them to understand that pain is never caused by just one tissue that is under stress or under damage. Pain is always felt in our body. It's not just felt in our tissue, so it's a whole body response. And more often than not in clinic, I see this, is that the person hasn't managed their volume and they haven't managed their intensity. And what they've done is they've been training at this high volume, high intensity, too much, too soon, for a couple of weeks. Could even be a couple of months. And some people, it could be a couple of years, depending how fit, how dedicated they are, how much they've gone down that rabbit hole of just trying to chase specific times. I'm constantly telling people that they need to learn how to run slow. They need to learn how to back off. Some days you need to just ease off. my specific point to people is you need to learn how to run slow. You need to learn how to manage your load. And I always tell people that the biggest mistake amateur runners make is that they go too hard on their easy days and not hard enough on their hard days. So they're stuck in that kind of grey junk mile zones of when they're going out for their easy runs, they're watching their watch, they're thinking about Strava, they're thinking about what that pace is going to look like on Strava, and they're just trying to push it on, they're pushing too hard, they're accumulating too much stress, they're not managing their load, their volume's too much, their intensity's too much, always one of those. And then on the other side, when it comes down to doing their workouts where they really should be hammering it, hitting out some good hard splits that are repeatable, they just can't do it because they've been too hard on the days before and the days after. So basically, I suppose my message in this video is don't always jump on yourself and think, right, I've got a tissue damage, I need to manage that. Don't always think that you need to rehab something. Sometimes you need to just think about the whole bigger picture of your body, of your health, of your sleep, your hydration, your nutrition, your stress in and out of work, your stress at home, your family, and then what are other meaningful things you like to do. And if you can manage all those with your running, and then try and just remember that your body needs time to adapt and to change. And if you don't give it the time to adapt and change, you're going to end up with a pro-inflammatory body. And therefore, when you do load it, that could be on race day, you load it and you end up with, you know, people dropping out race because they said they twisted their knee, twisted their ankle, whatever. It's not. They've just loaded it too much. They haven't let themselves adapt. And when they put that load on, the pain arises and they need to drop out. So my message is, think about the bigger picture. Think about your whole body, not just about one specific part of your body. Anyway, I hope this helps, guys. Any questions, let me know below. And remember, run far, run fast, but most of all, run sensible.